What can happen when the wrong drug is given to a patient? Sometimes nothing. Other times, major problems can arise. Major problems occurred when 2 pregnant women were given the wrong drug. 2 women at St. Mary's Hospital in West Palm Beach, Florida, were on bed rest on the same day. They were prescribed the drug progesterone. However, they were given the incorrect drug, Prostin E2. The drug was administered to Cherie Davis, who was placed on strict bed rest and given a script for progesterone to prevent preterm labor. She was pregnant with twins, and because her labor was induced, gave birth to them the day she was administered Prostin E2, where neither of them survived. Tessa Mae Sampson was 5.5 months pregnant and prescribed progesterone to help prevent premature delivery. However, she was also administered the wrong medication, Prostin E2, and she immediately began to feel extreme abdominal pain and cramping. She experienced this for about 4 hours when the nurses working with her decided that she simply just needed to have a bowel movement without further assessing her. She was brought a bedside commode and instructed to have a bowel movement. Shockingly to the nurse and herself, Tessa Mae gave birth to her daughter Trinia. Due to the unexpected labor Tessa Mae experienced, Trinia's oxygen supply was diminished and she suffers from severe terminal brain damage. The same error occurred within hours of one another and resulted in death and severe brain damage. It is surprising that after the first incident occurred and 2 lives were lost, more caution wasn't implemented when administering Prostin E2. The hospital states that there were multiple missed opportunities to catch the error. There was a suit filed, and the suit alleges that the doctor wrote a prescription for the progesterone in an unclear and sloppy fashion and did not specify dosage or amount. The hospital issued an apology statement and stated that they reported the medical error to the authorities. They also stated that they took the necessary steps to prevent this from happening in the future. Often, progesterone is thought of as a supplement many women who have reached menopause use to balance and oppose the effects of estrogen in the female body, because unstopped estrogen can create a stronger risk of developing breast cancer and reproductive cancer. In relevance to this story, progesterone is one of the hormones that helps a woman's body to become pregnant and stay pregnant. It helps treat infertility, and when used during an ongoing pregnancy, will factor into preventing a miscarriage. Research completed about women who miscarry show that their progesterone levels were relatively low. Therefore, doctors began prescribing progesterone to women who were showing signs of possible miscarriage or early birth. When used, the suppository is vaginally inserted usually 2 to 3 times per day and be continued up to 10 weeks. Prostin E2 has one use, abortion. The medication is used during weeks 12 to 20 of pregnancy to cause a natural abortion. It can also be used up to week 28 of pregnancy to remove any remaining materials from the womb after a miscarriage. When Prostin E2 is used, it causes the woman's uterus to contract, inducing labor and expelling the placenta and fetus or developed baby. Depending on when the Prostin E2 is given, the baby potentially can be birthed alive. Prostin E2 is also a suppository that is inserted vaginally, but is for a one-time use only. These 2 drugs cause exactly the opposite response of one another. They also have very different names that seem almost impossible to get mixed up. The only commonality of these 2 drugs is that they are both vaginal suppositories. Other than that, there seems to be no explanation of how they were swapped and administered to 2 different women, causing death and severe infinite brain damage. Quality is the cornerstone of everything we do. It is our passion to provide exceptional care to every patient we serve. This quote is what St. Mary's describes as their commitment to quality. Through their commitment, they have set these standards. Provide exceptional clinical care to every patient. Respect all patients, employees, and affiliated physicians. Maintain the highest ethical and clinical standards of care. Enhance the practice and delivery of every aspect of patient care. Safeguard the integrity and safety of our patients and employees. Enhance physician and nurse leadership and medical staff governance. Manage costs and resource efficiently. Share knowledge and best practices with other healthcare providers. St. Mary's obviously has intentions to provide exceptional care. So what went wrong? Did people become careless in following their quality commitments, or did their systems fail completely?
There were several things that went wrong that led to the death of the twins and to Trenia Guy's birth. The first issue with the system was there was not a clear nursing care plan for the patient. The patient was instructed to be on bed rest, but there was no indication as to what other interventions should have been implemented. A care plan is important because it is a way to incorporate the patient in their care. It acts as an agreement between the patient and the people providing them care, which helps to establish rapport. A care plan would have been beneficial in this case. The care plan would have included goals that the mother would have been working towards, support services that she may have wanted, emergency numbers, medications and why she was taking them, and possibly an eating plan. As a result of the care plan, the patient would have been educated about what medications she should have been receiving and would have known to question the nurse when she was given a medication she had never taken or seen before. The next problem in the system is the nurse received a prescription that could not be read and did not specify the dosage or amount of medicine to be administered. As a result, the nurse did not know what type of medicine to administer and thought she had deciphered the right medicine. However, this was not the case. It is not up to the nurse to decide the dose and amount of medicine that a patient should receive. The nurse should have called the physician the moment that she realized she did not know what medicine she was supposed to give. There are several things that should be included on a prescription, and the majority of those were not present on the one the nurse received. First of all, the amount and dose of drug was not included, and it should have been with the number of days of treatment. The schedules should have been written in English without abbreviations unless they are approved by the facility. The physician should have written the prescription more legibly, although in the hospital setting it is the responsibility and duty of the nurse to keep themselves informed about the nature of drugs being prescribed and their side effects. It is important that the nurse determine other medicines that the patient is taking and if they are compatible. If the nurse does not fully understand why a patient is receiving the medicine, they should clarify why with the healthcare provider. If the nurse had called in this case, she would not have given the medication. The nurse clearly did not use her 5 rights of medical administration. The nurse did not give the medicine to the right patient and gave it by the wrong route, but there was no way for her to give the right dose since that was not on the order. If the nurse had done the 3 med checks and compared the medication to the MAR, then she would have known that she was giving the wrong medication. The nurse should have known what the medication was for and what its mechanism of action was. If she did not know this, she should have looked it up. Clearly, she did not know what this drug was used for and did not look it up. If she had, she would have realized that she needed to call the doctor to determine why the patient was receiving the medication. The nurse should have been educated on normal side effects of the medication that she was giving. If she knew those side effects, then she would have been able to determine that the symptoms the patient was showing after receiving the medication was concerning. The nurse then could have called the physician and something could have been done. The nurse did not look into why the patient's status was changing, and as a result, the patient had her baby while sitting on the toilet. By assessing the patient after a medication is administered, the nurse can determine if the patient's respiratory rate, heart rate, or blood pressure have changed, and this will help the nurse determine if they need to intervene. If they do not perform this assessment, they will not know if the patient has had any changes in status, and a complication will occur like it did in this story.
To ensure that this error doesn't happen again, the best current practice needs to be implemented at St. Mary's Medical Center. Some of the practices that would change the outcome of our patients and their babies include: the hospital must have care and consideration when hiring and assigning personnel that are involved in medication ordering, preparation, dispensing, administration, and patient education. These selected personnel must be able to perform their task adequately. Policies and procedures at the hospital should ensure that these employees have a reasonable workload levels and working hours so they do not get overworked, increasing the risk for making a mistake. Potential source of error within the work environment, such as interruptions, should be minimized. There should be an ongoing, systematic program of quality improvement and peer review with respect to the safe use of medications. This is so that if an error does happen, it can be caught before it's implemented. Healthcare providers should write complete drug orders that include patient name, generic drug name, trademarked name, route and site of administration, dosage, form, strength, quantity, frequency of administration, and prescriber's name. The prescriber should write this in a neat and clear fashion so that the pharmacist, nurse, patients, and other healthcare providers can read it without hesitation. If others do have trouble reading it, confirmation from the prescriber needs to be obtained before administration. The nurse should look at the drug and determine if it relates to the patient's goal. If the drug's usage is questionable, the nurse should not hesitate to confirm with the prescriber why it is being used. By implementing these best current practices, St. Mary's could significantly reduce the number of errors that take place in their hospital. Nothing will take back the error committed to the 2 innocent pregnant women and their babies, but it is a time where we can learn from what happened and prevent it from happening again.
Some possible differences that other countries have with preventing medication errors are as follows. Canada uses an internet-accessible software called Analyze ERR, which records and tracks medication errors to find the cause for these errors. Some European nations focus on having good communication and rapport between the disciplines and have developed new specialized jobs to facilitate communication and medication error prevention. India has been working with 30 pharmacovigilance centers to collect and interpret data on drug-drug interactions. With using these techniques, maybe the error would have been caught. Other things that are being used in the United States and could be implemented to have prevented more medication errors are computerized physician order entry with decision support, improved pharmacy dispensing systems, barcoded medication administration, electronic medication reconciliation, and personal health records.
Many nurses do not read warning labels before giving the medications to the patients. Once scanned, if the drug will cause any harm to an unborn child, a warning should come up on the computer monitor. If the warning were to come up, a nurse would see she has chosen the wrong drug. By having this warning, that baby would not have been terminated. When obtaining a prescription, most individuals do not bother to read the warning label because of how small the font is. If the bottle has larger font, there will be no mistake of what side effects the prescription can cause.
There are many ways that communication can be improved in the hospital setting. Oftentimes, healthcare workers get so busy that they tend to rush things without even realizing it. For example, a doctor may be busy and rushes a medication order and as a result has very messy handwriting. This could cause miscommunication if the pharmacy, nurse, or others reads the order wrong. It is important that the staff effectively communicates with each other to avoid miscommunications that could compromise the health of the patient and, in this case, the patient's baby. Computerization in hospitals and healthcare facilities is also very helpful when it comes to communicating among healthcare workers. According to an article, Medical Errors in Clinical Risk Management, it has been proven that computerization helps decrease the incidence of medicine errors if the appropriate teaching is completed. Small steps towards improving medications such as these will help to save individuals' lives in the long run. Though it is expected that healthcare workers check all their medications before giving them to patients, very often medication checks can be put off or rushed. It is likely that some healthcare workers even skip doing medication checks once. Medication errors can be easily prevented by nurses if they are checking the medication ordered, the reason for the medication, its dosing, and whether or not it is being logically given in relation to the patient. By checking all of these things and inquiring about any orders that don't seem to make sense, medication errors are less likely to occur. Many medical errors can be caused when healthcare workers do not properly read labels. Many drug bottles and names look the same, making it easy for medications to get confused. By checking the drug name on the bottle rather than going by the appearance of the bottle alone, this will help to assure that the proper medications are being given. Checking labels should be incorporated into the medication checks before administering medication. This will ensure that the patient is getting the correct drug. What happened to Tessemae and Cherie was 100% preventable. With a better system assessment implemented, improvement of communication, better technology, and safety measures taken, errors like these can be avoided. This error led to two very serious and terrible outcomes.